Good evening, everyone, and welcome to the live discussion today with Dr. Abhay Bhave, Senior Consultant Hematology at Global Hospital, Parel, Mumbai. Today, we have an interesting topic know more about anemia. So, Doc, welcome on show.
Thank you very much, Jyoti, for having me there. Thanks.
Let me introduce Dr. Abhay Bhave. He comes with a years of experience, which is very rich, that is 30 years of experience. He's known for his accuracy in diagnosis and treatment. He is an MBBS MD from the prestigious Lokmanya Tilak Medical College and has done his advanced training in hematology from CMC Vellore. His experience is not only in the country, he's also worked overseas. He has worked in the Department of Hematology in Sultan Qaboos University Hospital in Muscat, Oman, and at the Department of Hematology in Westmead, Sydney, Australia. Dr. Bhave has conducted several camps for anemia, thalassemia detection, and given lectures on blood donation and blood cancer. He is a part of many organizations such as Mumbai Hematology Group, the Indian Society of Hematology and Blood, to name a few. With this, he is also very passionate about teaching, and he runs a fellowship in a leading tertiary care hospital in the city. So, Doc, it is so nice to have you with us. Welcome on show once again.
Thanks a lot.
So, Doc, let me start with the first question anemia. Today, we are talking about anemia. People speak about anemia. The Google educates us about anemia. But today, let us know from the expert what is anemia and what are the common symptoms of anemia.
Thank you very much, Jyoti. I think anemia is such a common ailment, if I can call it that, that it is very highly prevalent, unfortunately, in our society, in our community. If I have to define it, it's always hard to define anemia, but the simplest way to put it is a situation where the quantity and the quality of the hemoglobin is impaired. Now, there are reasons which are plenty for this to happen. Why I say it's quantity and quality is because you might have a person with a hemoglobin of 10 and he or she may have plenty of symptoms. You might have a hemoglobin of 5 and there might be no symptoms. So it's not only about the quantity, it's also about the quality. Just to let your audience know that the normal hemoglobin range is not very clear for the Indian population, but in general, we say for a female it should be 12 to 16, and for an adult male it should be somewhere between 14 and 18. In the pediatric age group, it keeps varying depending upon the age of the child. But generally, after about 14 to 15 years of age, their ranges are like that of an adult male or a female. So any value which is less than this, which I have quoted, is the one which is likely to be called as anemia and will need at least uh, a reason to be determined why it's happened. But then on the other hand, let us say you've got a female whose hemoglobin is 11, her range should be 12 to 16. How much would you go behind it in terms of finding a diagnosis? So then the quality becomes important. Is she symptomatic or is he symptomatic? Then that 11, although it's just borderline low, becomes important because there are symptoms. So we have to correlate the quantity and the quality and the history, put everything together before we say, let's chase this anemia and see what's wrong. And in
So,
terms
what
of,
are
I think you asked me about
symptoms
symptoms
as
also.
well? Yes.
Yeah, I think the commonest symptom that we experience is fatigue. Now, for those of us who are in the metro cities, all of us are fatigued, even with a good hemoglobin, because of the wear and tear of the day. But when the fatigue is persistent and the person feels weak and tired, unable to do what he or she was doing normally before, people of the same age group in the office or at place of work are able to put in more hours of work than what you are doing, which is unusual for you. When you have got something called as restless leg syndrome, pain of the legs at night, not being able to sleep well, someone looks at you and says, hey, you're looking pale, how come, what's wrong with you? Then they feel more tired after having been told that. Those who get swelling on their feet, those who get palpitations, which means in the heart rate goes high and you can hear your heartbeat. Those who get a little bit of chest pain or breathlessness on the minimum exertion. Some of my patients say that, look, I've been climbing these stairs to the station so often, and today I'm feeling breathless climbing them up. How is that? And so All these things are symptoms like breathlessness, chest pain, leg swelling, palpitations, fatigue, weakness are all common in the adults. And the pediatric age group, it's a little bit hard to get that. Again, they also feel listless and tired. But in the pediatric age group, you might find them being not only listless but not paying attention in class. So you'll have the teacher saying that, look, this child is not paying attention, is not doing well in class, and you realize that child is not able to concentrate. So lack of concentration is very common in pediatrics, and many times it's thought that the child is not concentrating, doesn't want to study. It may not be the reason. Maybe that the child is anemic. One needs to look at it.
So, Doc, moving to my next question, how do you confirm that this person is anemic? Are there only one test or there is a clinical examination? How is it?
I think you put it well, Jyoti. I think when someone tells us that they're feeling weak and tired and come with those kind of symptoms, we always do a good history taking and examination. And let me just tell you a broad outlook when a patient is sitting opposite me in the office or in the clinic. There are three reasons why a person can be anemic. Either you're not making blood, lack of production, or you're losing blood loss, or you're destroying blood. So production, destruction, loss. So when a person is in front of us, we've got, our textbooks have told us some differential diagnosis. It is running in our mind and it's in front of us. And we're talking to the patient, we try to find out which compartment is this patient in. That's how we try. So we ask history from them, we let them talk. Always let them talk. If you put words in their mouth, they'll say, yes, mala he hota hai, mala te hota hai, I feel this, mujhe aisa hota hai. It is better to let them talk. Let's first hear what are their symptoms. And then if they're not giving enough, because some people are not very good history givers, so we need to make them ask questions to make them answer. So we keep prodding them. Then I'll tell you what kind of symptoms we ask for. But overall, we ask for history. The commonest history we ask is, are you bleeding from somewhere? If, especially in a female, are you bleeding excessively during your periods? Which means, are you bleeding heavily on the second, third, and fourth day? Are you passing clots? Are you changing more pads in a day? This is extremely important for us to know that is that the site. We ask the males and females, do you have other sites of blood loss? Urine, piles, are you bleeding from the piles? You'll be surprised people don't answer because they're a little bit embarrassed. When we ask them specific, they say, yes, I've got piles for a long time. I get pain, there's blood in the pot. Many people don't look in the pot, so they don't even know. So I encourage them that, look, before flushing, just have a look. Then we ask them, do you have jaundice? When you got up in the morning, you looked at your eyes, you found they're slightly yellow. Is that the reason why you've come to me? Are you on any medications which could contribute to anemia? And so on and so forth. We keep talking to them. Black colored stools, poor diet. There are so many things which we keep asking, and we're trying to put them into a compartment. Is it a production, destruction, or loss? Why do we need to do this? We need to do this because as a doctor, I need to know what relevant investigation I have to do to get an answer. So, you can go onto Google and you can put in anemia and you will get a list of 40 tests that you can do, right? You don't need a doctor. You can do those tests and feed it into the computer. The computer will tell you, okay, now do this. You probably have that. Sure. The idea of meeting a doctor is to be able to decipher in your history which is the most likely chance of getting an answer, so that I spend less of your money and try to get a good answer for you so that I can treat you specifically. So history taking is a very important tool for me to find out which compartment and what test to do so that I can do best for you. This is followed by an examination. In the examination, we look for how pale is the person. We see the hands, the nails, the eyes. We see the tongue. We look for any swelling on the lymph nodes on the neck, in the armpits. See the swelling on the legs. We see any liver or spleen organ enlarged. Overall, we see how's this patient entering my clinic, how's this patient walking, how's this patient talking. All of us doctors have an intuition when we see the patient that something's not right. So a lot of things go into trying to assess what is anemia, because anemia is so general. There are so many things which come under it that it is our job to hone it down and try to cut it down to as narrow a strip as possible so that we can do relevant investigation. And then we confirm. So how to confirm? My starting point is CBC. A quality assured complete blood count from a proper instrument or a proper laboratory is the best way to go. It gives me all the values of CBC, hemoglobin, white cells, platelets. In hemoglobin, it tells me what is the size of the red cells, what is the quantity of the red cells, how much hemoglobin is there per red cell. Those are called red cell indices. So I might have a quantity of hemoglobin, say 10, but the indices tell me, is it iron deficiency 10, is it a vitamin deficiency 12, 10, is it a production defect 10. So the same value of 10 can be for various reasons. Those indices tell me how am I going to look at whether it's production destruction, whether it's because of a marrow problem, whether it's because of a drug induced. And one of the beauties we have is to see the slide. We see the peripheral smear, we see the slide under the microscope, and it gives us a lot of information about the patient. Remember, the peripheral smear is to us is like a mirror to the bone marrow. It tells us how the patient's marrow is behaving. It tells us the quantity, size, shape of the cells. It tells us its kind of behavior, and tells us what could be the possibility in this patient out of the differential diagnosis that we have in our mind. So confirmation is through a CBC, a peripheral smear, and then we do additional tests as per the CBC. So based on what we see in the CBC, we confirm it by relevant tests. For example, we can do ferritin for iron deficiency. We can do vitamin B12 for vitamin B12 deficiency, folate for folate deficiency, so on and so forth. It might be infection like malaria. We look for malarial parasites. It might be breakdown of blood, so we do direct Coombs test. So there are so many tests. But this two combinations, CBC and peripheral smear, is my starting point of the algorithm, which tells me which way I'm going to go. I've lost your voice, Jyoti. I can't hear you. Can you hear me? Jyoti, you can hear me? I can't hear you. While we're getting the audio on, can I just tell the viewers that in our country, unfortunately, anemia is common. And let me tell you that about in my experience, I'm also part of Lions Club, so we have done many camps,
True.
and we found about 60 to 70% of our population being affected by iron deficiency anemia. That's the commonest. And mind you, it's in the college going and school going kids, which is very disappointing that our future, our progeny is not very healthy in terms of its hemoglobin. And a low hemoglobin does affect the overall growth of the person. And let me also tell you that if a pregnant woman has anemia, then the child which is going to be born is also going to be anemic, and will have a lot of issues in the future life, with a lot of concentration and disabilities that might come. But it's so important that women are of a good hemoglobin, that our community has a good hemoglobin. If 60 to 70% are going to have iron deficiency anemia, it is extremely disappointing. Then there is vitamin deficiency, and we have in our country ethnicity, a beautiful country with ethnicity. So we've got sickle cells, we've got thalassemia, we've got spherocytosis, we've got G6PD, we've got so many other conditions which can contribute to anemia, either by itself or it can contribute some other cause and cause worsening of the anemia. So it's rampant, this anemia.
So, doc, that means it's quite commonly seen in the
Yes,
country.
unfortunately.
Yeah, it's very unfortunate. So, doc, are there different types of anemia? And does the treatment change?
Yes, certainly. I think that's a great question, Jyoti, because I think we divide it into um, production, destruction, loss. Amongst them also there are various other reasons. So if you have less production, it could be iron deficiency, vitamin deficiency, it could be thalassemia, it could be because of drug induced marrow suppression, it could be aplastic anemia. Amongst the destruction, it could be either destruction because of your own body's immunity going against you, it could be because of medications which are there, it can be because of valve which is destroying blood, it can be because of a bone marrow condition which is destroying blood. So there are different reasons within these compartments that can cause one type of a subtype or a phenotype. We need to find out what is the exact reason in it. So yes, there are different types, and the beauty is in trying to sieve through it, and that's where the challenge is. Sieve through the symptoms, sieve through the physical findings, and then try to get an answer which is closest to your patient's need. And with the help of CBC and a slide, it's, let me tell you, for us, it's much easier to do it.
Wow. So, Doc, now that you said that there are different types of anemia, the next question coming to you is, Doc, is anemia seen higher in females and lesser in males? Is it something like that? Because we keep on hearing this, that females are more anemic than the males. Is it true?
I think it's a tough question to answer because let me divide this thought process into metropolitan cities and outside. In the metropolitan cities, I don't think that the incidence is higher, but females tend to have menstrual issues, excess menstrual loss. They're embarrassed to tell, so they don't come forward to a doctor. Their nutrition sometimes may not be very good for whatever reason. It might be number of people in the house or whatever else it might be. So we do tend to see in practice more females coming to us than males, including in the metropolitan city, including in Mumbai.
Okay.
As you go away, I don't know, maybe worm infestation, people walking without slippers, injuries, infections, what's their diet, what is the kind of food they eat will also contribute to that. So it's a very hard question to answer. I don't think we have data, but yes, overall, females tend to have higher incidence of anemia than males.
Doc, actually, who are more prone to have anemia? Is there any disease that leads to it? Look, who are the people who are more prone? We can say, yeah, this particular kind of people are more prone to anemia.
No, I don't think there is a specific type or a cohort, but anyone can have anemia. It's a situational condition. But I guess those who have got excess periods bleeding are more prone to anemia. Those who have got other reasons for bleeding are more prone. Those who are not eating well, their nutrition is poor, or the hygiene is not good, they tend to have more anemia. Those who are taking certain medications which might affect the bone marrow production, they may have. Those who have thalassemia, inherited condition in the blood where the amount of production of blood is less. It's good quality but less production. So they can have. There is a condition called as spherocytosis when the red cells become circular, spherical, and they get destroyed in the spleen, so the hemoglobin remains a little lower. So there are some people who are more prone to it, but otherwise anemia can happen to anybody at any time, which is why we have to be careful about our own body and know our body. That what I was doing before I can't do now. Something's wrong. Meet a doctor or do a test and try to analyze what is happening. But it could happen to anybody.
So, Doc, considering this, um, my next question is supposingly a person is anemic. Now, how does anemia affects their body? What happens to a body when there is anemia?
I think the commonest is fatigue. That is the commonest effect. So body responds by being listless, not able to do or perform all the activities in the day, preferring to sit in one place or lie down, become not very involved in day-to-day activities, unable to concentrate and unable to be productive either at work or in society, or including for that in the home, in the family, being a little aloof and not being able to handle things. In kids, it can lead to short stature. It can give rise to behavioral changes because they start getting a low self-esteem. So they feel, I am not up to it, I can't do this, I'm not made for this. All these are more psychological symptoms or psychological events which affect the male, which affect the patient. In terms of physical appearances, unless it's inherited, such as, there are kids who are born with inherited diseases of the bone marrow or metabolic things, and they might have structural changes in their bones or body tissues. There can be certain changes in their physical appearance, like darkening of the skin, a shorter stature, smaller head. So there are some inherited conditions which can give rise to changes in pediatrics. And when we see them, we know that yes, this is likely to be a syndrome rather than your run-of-the-mill iron deficiency. It's something beyond it. And then just by seeing the person, we can get an intuition and an idea that we need to probably investigate a little bit more than what sees the eye. In an adult, usually the physical changes are more of being pale rather than any too much structural changes in them. That's why it's so easily missed, because people otherwise are well, they've got their muscle and they've got their activities and all that, but then they feel weak by the time they come home, and that they are embarrassed to tell anyone because everyone feels at the end of the day everyone is tired.
So, Doc, while you said that there are some inherited conditions that are seen, especially in the children, so you mean to say anemia is genetic?
Not always, but there are some conditions which are genetic, and therefore we always try to look for them to see whether they are existing in a family. So we also take a good family history, especially if it's a child. We go into the details of the family history, what happened to a sibling, parents, and on either side of the parents. So we do tend to take a history, but there are some conditions which can be genetic. Thankfully, they're not very common, but we should keep a watch out for them because there is an opportunity not only to treat that child but also to prevent the same genetic condition in the next child if they are planning another one.
Okay. So, Doc, what happens if anemia is left untreated?
They generally get worse. They just all the symptoms which I mentioned to you just get multiplied and make the person feel miserable to the point where they start feeling so breathless that they can't even move out of the house. They start getting swelling on the legs. They get a lot of palpitations. They can't sleep at night. They have to sit up because they get breathlessness the moment they lie down. And then at this point of time, they end up coming to hospital rather than to the OPD because unfortunately they'll have to be admitted, investigated, and sometimes even given blood transfusion, which is I'm not in favor of blood because blood is transfusion is like putting petrol into a car. It works for some time, then after that what? How often will you put that blood into the person? So getting a diagnosis is very important. But sometimes people don't understand that. They come in a bad shape, they take blood transfusion, they don't want investigations, they go off, come back again. And mind you, blood transfusion is not the answer. It is just temporary emergency method to improve your hemoglobin because life is more important than anything else. So once you have life, you can investigate further. But bringing up that hemoglobin is temporary. If you don't make yours, it's going to go down over a period of time. The body is going to eliminate those red cells from outside because while the blood group matches, the rest of the antigens don't match. So the body will reject it over a period of time and eliminate it. So if you don't find the answer in the meanwhile, a given blood transfusion will last you for what, 10, 12, 14, 21 days, depending upon the patient's clinical condition. After that, what? So these people come to us in a bad shape. They need admission, transfusion, but at the same time, before we give blood, we investigate them, find the reason, and try to treat the reason so that they don't come into this situation again. So unfortunately, if they don't get treated, they'll land up in trouble. They can have cardiac issues, they can have renal issues, they can have liver issues. These systems are all the whole system of the body is dependent upon blood carrying these cells inside them, and only red cells can carry oxygen. So if your red cells are low, oxygen is low, all the tissues get fatigued, all of them get tired, all of them suboptimally manage themselves, and therefore the whole body is affected when the hemoglobin is low.
Doctor, so anemia can be fatal then. That's what is possible.
Um, if it's too low, actually the cause of anemia is the reason of fatality. The low hemoglobin was an innocent bystander. It went low because of a reason. So that reason is the cause for fatality. So far, we've not lost patients to anemia unless the hemoglobins were low. My lowest hemoglobin which I've treated is 1.9 hemoglobin. You heard it right, 1.9. And we were able to salvage. But we found the reason. And the reason was treated and the hemoglobin came up, albeit with transfusions, of course. But The reason is the fatality, not the hemoglobin by itself. So anemia is an event. There is a reason that we have to find out. I don't like to give diagnosis of anemia. It's wrong. A diagnosis is never anemia. The event is anemia. The pathophysiology is anemia. The etiology is what gives rise to the anemia. So nutritional iron deficiency or a bleeding anemia because of say menorrhagia. So we go into great details. So anemia is just the event. The fatality is because of what causes it. So it could be a bone marrow disease like aplastic anemia. It could be leukemia, type of blood cancer. It could be lymphoma involving the marrow. It could be so many other diseases like aplastic anemia, which prevents blood from being formed. So that is the reason for fatality rather than just the hemoglobin.
This was very, very helpful, Doc, because we really, what I take a message right now is from all our discussions right now, it's very simple that one has to know the cause of the anemia to get it correctly treated. That's
Yes.
very important.
Yeah.
So, Doc,
So you know
moving
what,
on to
Jyoti, Jyoti, let me just tell you that if someone has anemia, gets a report of hemoglobin of 8.5, and says, okay, my neighbor took so and so medicine, and he or she got well, so why not me? All anemias are not the same. They are different reasons for anemia, and one should not generalize that all anemias have one treatment. I wish it was that way. It is not. So please don't lose time by trying to take treatments which are from a neighbor or some helpful friend or someone who's your, what should I say, shubh chintak, your well wisher. Try to get it analyzed because his or her reason may not be like yours. So you need to sort out yourself and get your anemia checked.
yeah, this is one of the problems, everybody wants to consult. Though they are doctors, though they are not doctors, they still want to consult. You just have to say that, I'm not well. You'll have 10 suggestions coming up.
True.
So, Doc, moving to the next question, you mentioned about leukemia. Now, leukemia and anemia, is there any connect between these two?
Yeah, certainly. Leukemia is leukocytes which are excess in blood. By the way, anemia has come from a Greek word, just out of the blue.
Okay.
And anemia came from the word called aneima. An means without, ima means blood. It's a Greek word. That's how it came as anemia over a period of time. Leukemia is the leu part is the white cell count, and amia means blood. So there is excess white cell count in the blood. It's called leukemia, where the white cell count goes up because of bad cells in the blood. So leukemia is known to increase the white cell count at the cost of the other cells, that is the hemoglobin and platelets. So in leukemia, it's not only anemia, it's high white cell count, it is drop in the hemoglobin and drop in the platelets. Unfortunately, people look at that hemoglobin value, they forget about the platelet count and the WBC, but leukemia is known to cause anemia.
So, it is a cause that can lead
The
to
cause, that's
anemia.
what we were talking about just earlier,
Yes,
that you try to find
causes.
out what is the cause. That's where it is. Yeah.
Correct. So, Doc, now you discussed about anemia. You said how what are the symptoms. You said there can be causes. So now what want to know from you is what are the don'ts if a patient is anemic? What is something they should not do?
Great question. Don't self treat. Okay, don't neglect it, don't deny it, don't go into a denial. You have a problem, there are doctors. I mean, there are doctors in municipal hospital, government hospital, and private sector. Go wherever, but go get yourself analyzed, find out the reason. Don't unnecessarily take treatment which your messages or your neighbor or your well-wisher is saying, that they don't understand you. Unless, of course, it's coming from a doctor, then your well-wisher could be a doctor. Why not? I'm happy for that. But let it come from a person who understands anemia and therefore be treated well. So don't fall in the trap of trying to self-treat and trying to self-administer drugs, because that might not be answer. And you might just get worse and come to a physician in a situation where you might be so compromised that we might have to admit and transfuse and try to find out the answer in hospital. Don't forget that will increase your cost a lot by getting admitted. We can always handle these things much better on OPD basis when the costs are much more under control. So don't do that, and I would say don't neglect your symptoms. If you got a symptom, it's persistent, please go and check. You know the healthcare system in India is fantastic. You can go to any laboratory, you don't need a prescription also. You can do a blood test. You say, I want to do a blood test. They'll do a blood test. CBC is done. So the healthcare system is fantastic. Every lane has doctors and labs. So please make full use of that. But get yourself evaluated. Don't be scared. Don't be scared. Anemia can be handled. Don't be scared. That's the last thing you should do.
So I got the don'ts. Now coming to the preventive measures. So before we end the show, I want to know what are the preventive measures for anemia?
Well, if it's a simple thing like iron deficiency, vitamin deficiency, or something, then just eat well. I know we all love. I love junk food. I also eat junk food, but I also do eat normal food. I also see to it that I am replete in terms of my food items. So you can go on the net, see an iron-rich diet, a vitamin-rich diet, choose what you like from it, and then have it on a day-to-day basis. Maybe mix and match and have it and do that. And yes, mix it with junk food because we all love it, enjoy it. So I think prevention is good nutrition. If you got excess bleeding during periods, go to your gynecologist and get it sorted as to what is happening. If you got bleeding from other side like piles, get it sorted from a surgeon or from your physician. If you think your diet is not appropriate, you can meet a dietitian or a nutritionist and sort yourself out. If you're excess weight like obesity, please get yourself treated because obesity is one of the reasons for getting anemia. So see to it that your health takes priority. Hygiene, see that your personal care is very good and you're clean. Most of the times you'll get away with this. And then one very important thing is to prevent yourself from getting worse. Please do the test when you're not well, so that you can take an appropriate opinion from a physician or a hematologist, get yourself evaluated, find the reason, and get back to normal life. That's not asking for too much. It's just asking for you to have a mindset that you need to get well.
Thanks, Doc. So before we end the show, the last question, what is your message to the viewers today?
My message would be first of all, thanks for joining. And second thing is that, anemia, anemia is like a banner under which there are various things happening. If you've got symptomatology, which we discussed, that lead towards anemia, get yourself evaluated. From evaluation, we'll find the cause. From the cause, we'll do the treatment and see that it doesn't happen again and again, so that we can take care of you and you can live back a normal life. If you don't get evaluated, if you don't take treatment, you're only going to get worse because the reason of anemia is not going to go because you haven't addressed it. So that's only going to get worse. So address it, get yourself under control, and you will lead a normal life. I mean, what 60 to 70% of the times in the community is iron deficiency anemia. For God's sake, it's one of the easiest to treat as long as you know what is causing it from below. Is it nutrition? Is it because of blood loss? Is it because of malabsorption? We can sort you out. And you don't have to go through all those symptoms. You can get back to a normal life and enjoy yourself. So don't neglect it. Don't be scared. Anemia is rarely fatal unless the cause, which is causing the anemia, that carries the fatality. And that is what we need to know so that we don't lead to fatality. We can sort it out. So don't be scared of anemia. It is just you're just one doctor away from getting evaluated for your cause and getting back to a normal life.
So I, as a viewer, take a message today that don't be scared of anemia, but do not neglect the symptoms either. Right, doctor?
I think so. Yeah.
Okay. So thank you so much, Doc, for joining with us today. And thanks for this wonderful, informative session. Thank you so much for being there today with us. And thank you, viewers, for joining the show today with us.
Thanks, Jyoti, for all your questions. They were very practical and very nice. I hope the audience would have gained some advantage. Thanks.
Definitely, Doc. Thanks.
Bye bye. See you.